Hello everyone, welcome to Physiotherapy in Lesotho, www.physioinlesotho.ch. You are listening to a podcast from one of our physio workshop in Lesotho. Your speaker is Thuso, W. Fasser, a qualified physiotherapist.
Let's talk this morning about movement therapy. We said in the 6 tools which we use in physiotherapy, movement is number 1. Movement, you can say, is a medicine. Movement we use everywhere. Movement is such an important tool in physiotherapy. And when we talk about movement therapy, then we mean active movement, that you probably write down now. Active movement. These are movements we do ourselves. When we do exercise, this is active movement. Active movement, exercise. Movement the patient can do himself. Then we talk about assisted movements. That means the patient does the movements, but I help him. I guide that movement. Maybe the muscle is weak, so I help that he can achieve the movement. Assisted movement is a movement where I help. The patient is working, I am working, we're working together to achieve the full movement. This is assisted movement. We have as well assisted walking. The patient cannot walk himself, but while I hold him, maybe I balance him, I help him to walk, I help him to manage the legs. This we call assisted walking. It's assisted movement. And the third group is passive movement. Passive movement are movements which the patient cannot do by himself, so we, the physio assistant, is doing it. We do these movements. Patient cannot do, maybe paralyzed the leg, or so weak that they cannot move, so I take the leg and I move that leg. This is passive movement. You see, we have 3 types of movements. Active movement, patient does itself. Assisted movement, we help. And passive movement, patient cannot do, I do it for the patient. And for all these type of movements, we have techniques, exercises and special techniques how to move the patient. And today we will learn passive movement techniques of the arm, of the leg, of the neck, how to roll over the patient and so on. We have techniques how to move the joints. Now let's talk in generally, what is the benefit of movements? Why the patient shall move? Why do we say doing movement, it helps to heal better? There are many positive effects of movements. One effect of movement is when you move, you activate your body. You get out of a passive status into an active status. So when I do active movements, I activate my body. And by activation of the body, we means there is more blood circulation. The blood runs better, heart is pumping and so on. There's more blood circulation. There is more respiratory activity. When you do exercise, you start to breathe. Oxygen comes into your body. You breathe deeper, you breathe more intensively. So we have more blood circulation and we have more respiratory activity. And when you move, you stretch your muscle, you stretch your joints. By stretching your muscle, stretching your joint, you get more flexible. So the flexibility of the body is improving. If somebody is not moving, always sitting or just walking but not doing exercise, he will get somehow a little bit stiff. As I said yesterday, these TB patients, when they are not doing exercise, they get in a slumped sitting posture and they get stiff on the shoulders and on the neck, the chest. So movement helps for circulation. Movement helps for more respiratory activity. Movement helps to be more flexible. Movement helps to get muscle power. When I exercise regularly, when I walk regularly, when I do steps regularly, when I do active exercises intensively, then my muscles will gain power. I will become stronger. So movement becomes more easy. If somebody is not moving, the muscles will weaken, they will become weak. And very quickly. If you lie in the bed for 10 days, the muscle probably will have only half of muscle power. We need to exercise to be strong. If we are not exercising, we get weak. So it's normal for somebody who was lying 3 weeks in the bed, when they start to walk again, they feel very weak. So movements help to gain muscle power. What we can say as well, active movements, doing movements helps to build up immune system. Today it's such an important topic, and we know if a patient moves regularly, his immune system is responding better. If we are passive, the immune system is responding less good. So doing movement is not only an important thing for the mechanics of the body, it's for the hormones as well, for the immune system. Regular movement keeps immune system alive. There is a psychological effect of movement. If you do movements, active movements, regularly movements, your psychology is somehow lifted up. You feel better psychologically. You get in a good mood by doing movements. In particular when you do active movements. So if somebody is depressed, doing a walk twice a day is so important for them. It helps them. They feel better in their psyche and they need even less medicine. It's so interesting. If a depressed person is doing twice a walk, a tough walk, they need less medicine and they won't have a relapse of their depression. So movement is for our psyche very helpful. Doing movements, you improve the awareness of the body. Movement can increase the awareness of the body, that you feel yourself. For us, it's normally that we feel ourselves, isn't it? There's no doubt, you feel your body. But if somebody is lying in the bed for 3 weeks and not moving, they don't feel the body anymore nicely. Or a paralyzed person has difficulties in the perception of the body. So they need to increase body awareness. The same for a depressed person. Very often they don't feel the body really. So when body awareness is increased, we can move better. And movements help us to increase body awareness. Movements can loosen the joints. If we have a stiff joint and we move regularly, the joint will become more mobile. Therefore, after POP, we teach the patient how to do exercise. You see, there are many effects of movements.
Yes.
Many positive results of movements. You see, how important is that we keep the banner high for physio in the hospital, for movements of the patient. It's so important. Now, I'll give you the specific advantage now of these three movement groups: active, assisted, and passive. There probably write down. You find it in the book, but write it already down so you have it until the book is arriving. Talk about active movements now. The benefit of active movements. We can say active movements strengthen the muscle. If I do every day this exercise of my arms, you can be sure after a week having done this exercise, my arm muscles will be stronger. You will see there is more muscle profile, the arms go up easily, and I can do it even more. Do you all know the exercise press-ups? You're lying on the belly and then you press your whole body up with the arm. You know that?
Yeah.
It's a tough exercise, isn't it?
Yeah.
If you are not trained, I'm not sure if you will be able to do 20 of them.
No.
They're already tough 20, maybe 10. But if you do them every day, so in the morning I do 10, at lunch I do 10, in the evening I do 10. The next day I will do 12. The next day I will do 14. I can guarantee you after a week you will do 20 easily. And again, reading the book of Nelson Mandela when he was in prison these 27 years, every morning he did exercise. Do you know how many press-ups he did in that little cell? Imagine, guess. 200 press-ups on the fingertip. This is a terrible, tough exercise. But he slowly, regularly, he did it and he came up. This is strong, this is tough exercising. So you build up muscle power by doing active exercise. We do it slowly but regularly. Exercise, active exercise, they build up muscle power if you do them regularly. You do enough of them, but not too much and not too little. If I do just one press-up a day, after a week, I won't be able to do 20. So you have to do more. You have to do enough exercise. But if I start doing 200, I will hurt me. So we have to do enough exercises, not too much and not too little. But exercise, active exercises, they help to build up muscle strength. This is one of the aims of active exercise. 2, active exercises, they increase the body flexibility. Maybe today, when I go up with the arms, I feel it's somehow stiff. But if I do it every day, after 10 days, you will be a bit looser. So active exercises, they stretch the tissue and will increase the body flexibility. We get more mobile. The TB patient who's sitting slumped is all stiff here, doing every day this rolling exercise of the shoulders, stretching the chest. After 10 days, he won't be stiff anymore. He will be more mobile. He will move the chest better. The lungs will expand. More oxygen comes into the lungs. The healing process is supported by this exercise. This is how we are thinking in TB physio. So, regular movements increase flexibility of the body. Active movements, they are very good to increase circulation, blood circulation. Remember, when there is a bad circulation on the legs, the most important medicine is active exercise. With the medicines, you never have the same result as when you do active exercise. So if we have a patient with a bad circulation, they will take the medicine and they shall do active exercises. The blood circulation will be much improved. We all know that when it is cold, we feel cold in the body. Then we have to walk somewhere. We do a tough walk. Then we will feel warm, isn't it? Or in the morning you stand up, you are cold, but when you move at work, then you feel warm, because the body, the movement is producing warm heat in the body, circulation. So active movements, they really increase the blood circulation. And by increasing blood circulation, it's not only the peripheral blood circulation, so that the blood is going to the fingers and to the feet, to the toes. It's as well that the heart is somehow stimulated, animated. When I exercise intensively, my heart pumps more. We know it when we are running up the hill. Oh, the heart is pumping very much. So, heart function will be improved. So we are increasing circulation, central circulation at the lungs, the heart is pumping more, and peripheral circulation in the fingers and the feet. This is a very important effect of active movements. And then, as I said, active movement helps to increase body awareness. There are many more effects of active movements, but let's say these are the most important ones. Now, every patient can do some movements by himself. Very rarely you have a patient who cannot move at all. I remember a paralyzed patient, he was paralyzed until here, to the neck. The whole body was not working, was floppy, no muscle tone. It was just like a piece of cloth. He could move only the head and the face and the eyes. So after half a year working with him, the thumb started to move. So I gave him many thumb exercises. He couldn't move the body, but the thumb he could move. So at least he did these exercises by himself. The other movements I did to him. With that, I want to say, whatever the patient can move himself, let him move self. Keep patients actively. What they can do, they shall do themselves. Even if it is a little movement, they shall do it themselves. Sometimes we just have to stimulate them to do it. Again, TB physio, TB patients very often are passive. They are so sick, they are weak, they have sharp pains and the medicine and so on, so they feel like doing nothing. Not because they are lazy, but they are somehow passive. We call it's a passive regressive coping style. They think not moving, waiting until disease is over is the best strategy. As animals do. If you see when a dog is ill, what is the dog doing? It's just lying in the shadow, not moving at all, waiting until that thing is over. This is an archaic strategy to come over a disease. And for some diseases, it's even good you just lie in the bed and you wait for a few days and things are better. But as TB is not something like this, after a while, when, let's say, when they are no longer so very much sick, then we have to become active. Okay, now let's go to the second group of movement, assisted movement. As we say, the patient can move, let's say the arm, but has not enough force to go up. Let's say a paralyzed person. He can bring up the arm, but not completely. So you, as the therapist, you go, you hold that arm, and you complete the full range movement with your help. This is assisted movement. We assist to achieve full range movement. This is assisted movement. Patient can move, but not completely. Physiotherapist takes the arm or whatever and helps to complete the movement. This is assisted movement. Now, the benefit of assisted movement. We maintain full range of motion. So that joint, even the patient cannot move completely himself, we help to do it so the joint won't become stiff. Joints, when you are not moving them, quite often they will become stiff. So we maintain full range of motion. That means we maintain the full movement. Is that understandable? Habe. We maintain the flexibility of the body. If we have the TB patient sitting always like this, and I say, oh, now lie on your bed and let's stretch together the arms, we open the chest. If I do that every day with him, the chest won't become so fixed. Will be flexible. Habe, with assisted movements, we increase blood circulation. A little bit, not as much as active movements. Active movements, they increase it much more. But at least a little bit we do. Let's say I lift the leg up. The venous blood will run out of the leg. So we increase circulation. When the patient on bed rest is lying only on bed rest, he cannot move the legs. If we come and we move these legs passively or assistively, and we move them up, high up, blood circulation is activated. It's already something. Doing assisted movements, we maintain body awareness. When you touch the person, he will feel the body. It's important to be touched for us human beings. It's important that we feel ourselves. What assisted movements are not able to do is strengthening muscles. This is the big difference between assisted movements and active movements. Active movements, they increase muscle power. Assisted movements, they are not really helping to develop muscle power. Now we're coming to passive movements. Passive movements, they help to maintain full range of motion. Full range of motion, so that we move completely. Passive movements stretch soft tissue and maintain flexibility. With passive movements, you can stretch stiff joints. After POP, the ankle, so you stretch stiff joints. Passive movements maintain full range of motion. Passive movements maintain full range of motion. And passive movements, they increase the flexibility of the body. You can stretch stiff joints. Passive movements activate the blood flow. Not so much, but a little bit, yes. And passive movements, again, they increase body awareness. There are other movement classes like isometric movements. That means I'm just making the muscle tight. I'm not moving the joint, but I'm making the muscle tight. If you make the stiff arm, you stiff now, you can not move. That means muscles working isometrically. We are not moving the joint. This is a type of movement, isotonic movements, and so on. Now, don't talk about that. We don't talk about that now. We're just talking about active movements, movements which are done by the patient. Assisted movement, patient is moving and physio is helping. And passive movement, patient cannot do himself, but physio is doing it. For all these three movement classes, groups, we have certain exercises. And we have special movement techniques and special handling techniques, passive movement techniques, to move the joints safely. Now, just as a rule, that please write down. 3 rules, and you will see it's linked to the movement groups. Let the patient do what they can do themselves first. Let the patient do what they can do themselves. Don't do movements which the patient can do himself. If a patient can sit up, tell him, sit up please, and you wait until he's sitting up. Don't pull him up just to gain time. So let the patient do what they can do themselves. Maybe patients are slow or you are in a hurry, but let them do what they can do themselves, so they are active. Don't do movements which the patient can do himself. Let's say in a hemiplegic patient, the left side is maybe paralyzed, the right side is working normally. So it's clear that patient maybe can wash the face and the top half of the body with his right hand nicely. Maybe you have to help him only to wash the private parts or maybe the back. But the part they can do. So the nurse is coming and saying, you can start to wash yourself and I will finish up all that what you cannot do by yourself. So you give the patient a chance to do what they can do themselves. Or when I go and I mobilize the patient, I want to have him on a chair, then I say, you can sit up now. When you're sitting, I'm coming, and then I will help you to stand up. So the patient slowly, organizing himself and sits up. So let the patient do what they can do themselves. Rule number 2. Help the patient to do movements which they have difficulty with. So if the movement is not so easy to do for them, if they are not stable in sitting, They can come and sit up, but they are not stable, let's say. So I help them that they are not falling out of the bed. I'm not doing the movement for them. I don't pull them up to sitting. I just help them to balancing, by example. So help the patient to do the movements which he cannot do by himself. We assist. Where the patient needs help, help him. And the third rule is, do the movements which the patient cannot do. It's the opposite of the first rule, you see. Let the patient do what they can do themselves. You shall do that movement which a patient cannot do himself. And then there is in the middle, help where they need help. Isn't it simple? So you know already when to do which movements. Whatever the patient can do himself, you teach exercise. Where they need a little bit help, you do assisted movements. Where they cannot move themselves, you do passive movements. It gets easy like this. Very often when you work with the patient, you work with all three types of movements. You give them some exercises, some movements you help, and some you are doing. This is normal. You will see when we go then to the ward. So this is basic on movements. Now when we work with the patient, there are some necessities which we have to have. One is patient shall be dressed. So they have the pyjama so that they can move easily without being embarrassed. If they are not dressed, maybe they're so sick and so, we just take the screen around. But if they are dressed, you don't need even the screen. We have to have space around the bed. So they shall be dressed. Dressed in a way that they can do the movements. Second, take off the blankets and the pillows of that bed. Sometimes there are so many blankets, so many pillows in the bed. I take that off, I take a chair next to the bed and I put these blankets there so that the whole bed is free to move. If the blankets are not taken away nicely, you're always in trouble with the feet and the blankets and so on. Very often there are 2-3 pillows. No, one is enough. If it is maybe a dyspnoic patient, of course, then he needs 3. But if not, take off these pillows. One is enough. Make space that you can move the patient. Prepare the situation that you have space to move the patient. And 3, we should be able to walk around the bed. Because if I work with the left arm, I have to be on the left side. But then when I go to work on the right arm, I have to go to the right side. So make space that you can go around the bed. Free access to the patient. If that bed is just pushed to the wall, I just pull it towards the room so that I can go to both sides. Now sometimes you have a big patient. Maybe he is obese, big man, big me. And you are maybe small. You cannot handle by yourself. Let's say you have to mobilize the patient. Patient should start to walk, was on bed rest for 2 weeks. He's very big. So organize yourself to be in 2. Always look at the patient. Am I able to manage this patient safely? If not, organize yourself in 2. Because if you have big ndate, and that ndate is maybe a bit dizzy, and it's just shaky somehow, maybe you won't be able by yourself to cope with him. So it's better you judge the situation before. Am I able to manage this case safely, or do I need somebody who's assisting me to be in 2? Very often with hemiplegic patients we work together. Or if we have a very sick person, we work in couple, being two. We manage better. And if the patient is a very big one, so it's probably better you do it in two. When you mobilize a patient, there should be always another person in the room. Somebody was maybe 10 days in the bed, now you bring him to sitting up posture, standing up posture. It can be that the patient becomes dizzy and maybe he's a bit slumpy. It's always good when you can say, oh, Ausi, please come, rush, help me here, if there is somebody around. So when you mobilize a patient from the bed, just make sure that somebody is around. If you need help, you call and that help is coming.